My name's Haley Edwards. I'm an editor here at the Washington Monthly, and we're here with my colleague Phil Longman today to discuss his recent article for our upcoming issue of the Washington Monthly. It's about how conservatives and corporate interests have slipped some language into Obamacare that makes cost-benefit analysis that makes it illegal. Can you tell us more about that?
Well, sure, Haley. One of the things that's most important to the whole idea of Obamacare is that we somehow be able to overcome the tremendous amounts of waste that are already in our healthcare system. By some estimates, the amount of money that we spend on healthcare that brings absolutely no benefit to patients and is often harmful is somewhere between 30 and even 50%. The promise of Obamacare is that we'll be able to expand access to more people, even as we get the waste out of the system and improve its quality. So far, a great story. Unfortunately, in the course of this landmark legislation, the Affordable Care Act, certain language was inserted deep into the details of the bill that literally make it illegal for the government to even conduct research onto what treatments, what pills, are more effective than others, cost effective than others.
So how are we supposed to determine which procedure or which medicine makes us healthier if we can't compare those two?
Well, here's the problem. That let's say we have two drugs. One, you take this drug, you live 1 year longer in perfect health, and the drug costs $5. We have this other drug, you take it, you live 1 year longer in perfect health, but it makes you blind, and it costs $10,000. As things stand right now, the government would be in no position to say, even to recommend to Medicare, to individual patients, you know what, you might want to take the first drug, not the second drug. Right now, ask me, how did that happen? It's because it all comes out of this discussion we all remember about death panels. What was that all about? What that was all about were certain interests in our society who felt that it would not be appropriate for government to make any effort to determine what drugs and procedures improved or detracted from the quality of life. In the summer of 2009, the pharmaceutical industry, big pharma, caught wind of the fact that the Obama administration had actually set out to measure the cost effectiveness of healthcare. And they were very alarmed by that prospect, because it would mean that somebody might actually evaluate the effectiveness, cost effectiveness of their products, all the pills they make. And so they launched a campaign, a public relations campaign, that led, in short order, to all sorts of people characterizing such research as an example of death panels, of rationing, and like that. Unless we can overcome this obstacle, the very premise of Obamacare becomes problematic. The premise that we can increase access and improve quality and save money all at the same time. This only makes sense if we can find scientific ways to get the waste out of healthcare. So what I'm saying is the time now for healthcare reformers is to focus on this particular aspect of the Affordable Care Act. This is the next great legislative fight we have to have.
Is there a way you and I can help with this? That those of us who hope to get the medicine that costs $5 and doesn't make us blind, is there a way we can advocate for that?
Once we do educate ourselves and the public better, I think it'll be easier to create the climate of opinion in which people can recognize, oh, we're not talking about death panels, we're talking about science and medicine.
Thank you.
Thanks.